In critical care settings, one of the main causes of organ failure and ultimately mortality is loss of endothelial function, which is associated with leakage of blood vessels. Although the symptoms of loss of endothelial function are well known, there are currently no simple blood-based detection methods established for monitoring the worsening and improvement of endothelial function. Research has identified bioactive adrenomedulin, bioADM, as a controlling hormone of the endothelial barrier, the interior wall protecting the blood vessels. In certain conditions such as septic shock, acute heart failure, or cardiogenic shock, the endothelial barrier becomes leaky and additional bioactive adrenomedulin is produced to reseal the barrier. However, bioADM has a second function. It also expands the blood vessels, resulting in a dangerous blood pressure drop, which leads to shock and may ultimately escalate into multiple organ failure. BioADM can easily be measured in the blood, enabling the assessment of the loss of endothelial function up to 48 hours before the symptoms become visible. Regular assessment of the bioADM levels allows for the monitoring of critically ill patients. Elevated bioADM levels predict both blood pressure drop resulting in shock as well as leaky vessels leading to the formation of edema. Decreasing levels of bioADM reflect an improvement of the endothelial function, which is closely associated with the patient's clinical condition. Using the Sphingotec bioADM assay, measurable on a point-of-care analyzer or on a microtiter plate, clinicians can now monitor blood levels of bioADM to identify treatment responders and non-responders in order to improve patient management, including discharge decisions. Learn more at sphingotec.com.